Okay, this slideshow is going to be about obstetrics, gynecology, female reproductive system, and neonatology. In medical terminology, first of all, we will look at the egg and ovary. The technical word for the egg is the ovum, so we will use a double O, which is actually pronounced like a long O. So ooblast would be the embryonic egg cell, and oogenesis is the formation of an egg cell. And since the ovary is the thing that produces the egg, we use the term ophoro. Ovulation is the process of releasing an egg. So the ovum here you can see develops, is released, and then leaves a scar tissue called the corpus luteum, which we will learn about later on. The ovum, or the egg, then travels through the oviduct, or the fallopian tube, into the uterus where it will be implanted. An obstetrician takes care of pregnant women and delivers babies. A gynecologist specializes in disorders of the female reproductive system. In American medicine, you have to be trained in both. You are an OBGYN, or obstetrics and gynecology. So conditions of the ovary could include ophiritis, which would be inflammation of the ovary. Ophorectomy would be the surgical removal of the ovary. An ophroma would be a tumor, most likely benign, of the ovary. An ophoroptosis would be a falling of the ovary. The ovary should be held in place by suspensory ligaments, and if those are not properly intact, the ovary may fall lower in the pelvis, which would mean that the ovulated egg would not make it into the fallopian tube. If you had ophoroptosis, you would want to have an ophoropexy to put the ovary back in place. The uterine tubes, which are also sometimes called the oviduct, and another term for the oviduct would be the fallopian tubes, spelled with a F. So F-A-L-L-O-P-I-A-N, tubes. It is not spelled with a PH. It is not the Philippine tubes or the Philippian tubes. It was not a small Greek nation that the Apostle Paul wrote to, or an island nation in the Pacific. The word for uterine tubes is salpingo. So a salpingoscope would be something that allows you to look in the uterine tubes. Salpingostomy would be making a cut into the uterine tubes. Salpingitis would be inflammation of the uterine tubes, and salpingo-ophiritis would be inflammation of both the uterine tubes and the ovaries. The term we use for the vagina is colpo. So colpodynia would mean vaginal pain. Colpospasm would mean spasm of the vagina. A colpoplasty would be surgical repair of the vagina, and colposcopy is using a tool to look into the vagina. In this image, you can actually see the female reproductive system. The ovaries sit in the pelvis. Right here. The uterine tubes then take the ovaries into the uterus. The uterus, as you notice here, is flexed forward and tipped forward. That is, we actually call that anteflexion and anteversion. And then the vagina comes out behind the bladder and the urethra, and then anterior to both the vaginal opening and the urethral opening is the clitoris, which is a piece of tissue that is homologous to the penis. The uterus, the word for uterus, or the uterus in general, is hystero. So a hysterotomy would be cutting into the uterus. Hysteropathy would be a disease of the uterus. And also hysterectomy would be surgical removal of the uterus. The tissues of the walls of the uterus, we use the word metro. So there is an endometrium, a myometrium, and a parametrium. And the endometrium is on the inside, the parametrium on the outside, and the myometrium is in the middle, made of muscle. Endometriitis would be inflammation of the inner layer of the uterus. So a hysterosalpingo-oophorectomy, if you look at that, it's a hystero means the uterus, salpingo means the uterine tubes, and ophoro means the ovaries, ectomy means surgical removal, so that would be a total hysterectomy, a hysterosalpingo-oophorectomy. A partial hysterectomy would typically just remove the uterus and leave the fallopian tubes and the ovaries intact. Hysteroptosis, that is a actual herniation, that is actual intussusception of the uterus. Colpoptosis would be the vagina coming out. Hysteropexy would be the process you would use then if the uterus had actually prolapsed in a hysteroptosis. You would use a hysteropexy to fix it in place. A hysterocele would be a bulge in the uterus that actually presses into the rectum. Abdominal wall, remember the word for the abdominal wall is a laparo. Laparoscopy would be looking inside the abdominal wall. Laparotomy would be an incision into the abdominal wall. Laparaphy would be suturing the abdominal wall, and a laparocele would be a herniation of the abdominal wall. And of course, surgery that's done through the abdominal wall is referred to as laparoscopic surgery. Centesis we've done before, a surgical puncture. We draw fluid out with this. So abdominocentesis would be putting a needle through the abdomen and taking fluid out. Pleurocentesis would be the same thing with the pleura of the lungs. Thoracocentesis is actually what we call the pleurocentesis. We're just doing it specifically in that part of the lungs. Amniocentesis we've looked at before. This is when they draw fluid out of the uterus, the amniotic fluid, to test for birth defects. Here's an image of an amniocentesis. You can see that the needle has to go through the thickness of the belly, and then the belly is out here, the uterus is here, and then through the placenta to draw fluid out. And that will either draw cells that have been sloughed off by the fetus or by the placenta, both of which will have the DNA of the baby. Two words for breast, masto and mammo. So mastitis would be inflammation of the breast. A mastectomy is surgical removal of the breast. Mammography is what we would call basically taking a picture of the inside of the breast. It's a special type of x-ray. And mammoplasty would be surgical repair of the breast. Menses is the term that we use to describe the flow of blood during the cycle. So menstruation is the actual process of having your period. Menopause means that you have stopped having your period. We don't diagnose menopause until a woman has gone a full year without having a menstrual cycle. Menarche is the technical name for the onset of menses. And menorrhea is the flow of blood and tissues that happens during the menstrual period. Dysmenorrhea would be a bad, usually more painful version of normal menorrhea. Pregnancy and birth. We use the word gravida to refer to pregnancy. So if you've been pregnant Twice you would be duogravida. If you've been pregnant many times, it's multigravida. The first time you are pregnant, we actually use the term prima gravida. Para means live, viable births. So multiparous means you've had multiple children. Primipara means this was your first. An ectopic pregnancy is a pregnancy that happens where the fertilized egg is implanted anywhere but where it should be. And it should be somewhere either along this wall or this wall. So if it implants anywhere up here or in the tubes, or in this case they're showing it on the ovary, or it could even be down here somewhere in the pelvis or abdomen, that is an ectopic pregnancy. A tubal pregnancy is a particularly dangerous version of an ectopic pregnancy because it can end up killing the mother. And this will typically need to be removed sooner than later. Terms related to birth, nato or nate means birth. So postnatal means just after birth, prenatal means before birth, antenatal means immediately before birth. And neonatology would be the study of or the treatment of newborns. This also, if you celebrate Christmas, this is where the term nativity comes from. Sexually transmitted infections or diseases. Syphilis is a bacterial disease that will cause cankers on your genitals, which at first will be painless and hard, later will ulcerate, and then eventually go away. But the problem is if it is not treated at that point, then it tends to go and infect other systems in your body, specifically the central nervous system, and it will actually cause a type of insanity, which is known as syphilophobia. A syphilopathy would be any disease caused by the syphilis bacteria, Treponema pallidum. Syphiloma is the name we would give to that canker that will develop. It is a non-cancerous enlargement or growth. Other STDs would include stuff like gonorrhea, chlamydia, those being the two most common bacterial STDs, and herpes, hepatitis A, B, C, D, E, and all of the different versions of that, as well as HIV. So what does colpo mean again? That means vagina. Laparo means abdominal wall. Masto means breast. Amnio means amniotic sac or fluid. Dynia means pain. Otomy means incision. Ectomy means excision. And centesis means surgical puncture. So colpodynia would be pain in the vagina. A laparotomy would actually be an incision into the abdominal wall. A mastectomy would be surgical removal of the breast. And amniocentesis is a surgical puncture of the amnion. An ophoroma would be an ovarian tumor. Hysteropexy would actually be surgical fixation of the uterus. Salpingitis would be inflammation of the uterine tube. And a metrocele would be a herniation of uterine tissue. Here's a picture of a really bad case of genital warts, which is caused by the human papillomavirus. Menstruation begins at puberty. The onset of menstruation is called a menarche. Each month, the pituitary gland releases follicle-stimulating hormone, which causes a small number of primary oocytes, or early eggs, to complete meiosis and be released. If you are a German speaker, you know that Mittel means middle and Schmerz means pain. So literally, Mittelschmerz means middle pain. This occurs during ovulation. When the egg is ovulated, it actually ruptures through the ovarian membrane and causes some scarring, and that will actually cause some pain that most women will feel about midway through their cycle on one side of the pelvis or the other. Ovarian hormones, estrogens. Estrogens, it's not estrogen, it is not one hormone, it's actually a group of hormones that are produced by follicle cells in the ovary. These hormones are the things that drive most of the menstrual cycle. They also cause the development of secondary sex characteristics like pubic hair formation, breast development, fat pads in the hips, dispersal of fat throughout the body. Progesterone is produced by the corpus luteum, which is that scar tissue that formed as a result of ovulation. Helps to maintain the uterine lining during early stages of pregnancy, and it causes the breasts to develop and grow so that they can lactate. The placenta will eventually take over production of progesterone, and that must be there to sustain the fetus. If it is not, you will have a miscarriage. So gonadotropin levels, the follicle stimulating hormone and the luteinizing hormone, will stay relatively flat and then spike, leading to ovulation in response to estrogen levels rising here. And the follicle stimulating hormone and luteinizing hormone will then cause progesterone levels to rise as the estrogen levels start to fall. And you can see the estrogen levels make a little bit of a comeback. So right here, roughly 1 week before menstruation and 1 week after ovulation, you will notice a very, very high levels of estrogen and progesterone, which are actually retaining water in preparation for the implantation of the fetus, or implantation of the fertilized egg, sorry. This is also why many women notice bloating about a week before their period. While the function of the uterus is to accept a fertilized egg, it isn't always able to do so. Cycle lasts about 28 days. Days 1 through 5 are menses. So menstruation, the first day of menstruation is the first day of your cycle. That is the definition of the beginning of the menstrual cycle. Days 6 through 14, you'll start to see a rise in estrogen levels, which will cause the building and the development of the endometrium. This is called the proliferative phase. And then usually on day 14, you see ovulation occur. Ovulation occurs, causing the production or the creation of the corpus luteum, which now is secreting progesterone. And so we are in what is called the secretory phase. Here's what is happening in the uterine wall during each of the phases. During the menstrual cycle or menstrual phase, the uterine wall lining sloughs off and most of it is gone except for the basal layer, which is there to produce new cells. In the proliferative phase, it grows and grows. The secretory phase, it continues to grow because remember, estrogen levels are high until about here, and progesterone levels are rising. Both of them will drop off right about here drastically, which will cause sudden death of all the blood vessels going to this tissue, which will then lead to the death of the tissue itself. So menses occurs on day 1 through 5. Endometrium is sloughed off. It's typically accompanied by bleeding, anywhere from 50 to 150 milliliters of blood loss. By day 5, the ovarian follicles begin producing estrogens again, which leads to the proliferative phase, days 6 through 14. Rising estrogen levels cause the endometrium to thicken. The egg is released at the very end of this phase, and that leads us to the secretory phase. Progesterone levels increase because you've created a corpus luteum. Endometrial blood supply increases due to elevation in progesterone. Endometrial glands provide the fertilized egg with nutrients. If the egg is not implanted, the corpus luteum dies and the progesterone levels die off or drop off, causing the blood vessels to wither and die, leads to the death of the endometrium. Mammary glands are modified sweat ducts that are actually found in both genders. Estrogens cause them to increase in size during puberty, and then other hormones will cause them to lactate following delivery of a baby. They are deep in the breast tissue and they pass milk through lactiferous ducts. So in order for pregnancy to happen, sperm must reach an ovulated secondary oocyte. The oocyte is only viable for about 12 to 24 hours, so up to a day following ovulation. The sperm is only viable for 12 to 24 hours, maybe 72 hours. So if you look at this, you're basically saying that there are only about 3 days out of the month you can have sex and get pregnant. Acrosomes, which are on the head of the sperm, these are enzymes that actually rupture and burr their way through the protective coating around the oocyte so the sperm can penetrate. And once the sperm ends, the fertilized egg changes its walls so no other sperm can enter. Here's a picture of the endometrium. And you can see they call this the stratum basalis. This is the part that never sloughs off. This is the stratum functionalis. This is the part that does slough off. But it's also the part that if a fertilized egg is implanted, that's where the baby will develop.